Hidden cause number 21 why you still have low thyroid symptoms, even though you may be taking thyroid medication and even though your lab tests may look normal, is elevated cortisol suppressing thyroid hormone receptors. Now, we've talked about cortisol doing a couple other things in terms of thyroid hormone chemistry, but this cause is one in which cortisol levels are too high and it suppresses the receptors on cells for thyroid hormone. We call those alpha 1 and alpha 2 receptors. So what does this look like, clinically, symptom-wise? What would a person have? Well, first thing you would have low thyroid symptoms, which could be things like brain fog, depression, hair loss, weight gain, constipation, dry skin, dry hair, muscle pain, infertility, high cholesterol. You could have all those things, go to your doctor, get tested, and they might, do a full panel, but they might diagnose you as hypothyroid based on your TSH and T4 levels. If that happens, you'd be taking your medication, but then you really don't feel any better. And that's one scenario. In that scenario, cortisol could be too high for a variety of reasons I'm going to tell you about, and it could be suppressing the receptors. So you could have all the medication you want floating around in your bloodstream, but even if it docks onto the receptors, it shuts down. The receptor doesn't really, it doesn't really click. And so let me explain kind of what that means. Another way of talking about this is to call it resistance. See, what normally happens is you've got a receptor on the outside of the cell, and when the hormone comes along and docks, it causes some changes inside the cell, and some messages go to the nucleus of the cell, and DNA starts to, produce different proteins. That's called a transduction. You don't have to remember that. But what happens when you have high cortisol is it basically shuts down the message from traveling from the receptor into the inside of the cell, and that's what we call it resistance. So if you've got the type of scenario in which you were diagnosed hypothyroid, but you're taking medication and the labs look normal, but you still feel low thyroid, well then this could be one of the mechanisms. So here's the other scenario for that. The other scenario is you never got diagnosed hypothyroid because your lab numbers look totally normal the whole time. This actually happens quite a bit. You still have those low thyroid symptoms we just talked about, but when you go in, your T4, your TSH, your T3, all that looks normal because blood tests don't look at receptors. Blood tests can look at levels of T4, T3. They can look at levels of thyroxine binding globulins. You can look at reverse T3. But there's no way for us to look at what's going on at the level of the receptor. So it's kind of like a process of elimination. So you may have never got diagnosed hypothyroid, even though you got all these hypothyroid symptoms. This could be one of the mechanisms because if you didn't get diagnosed, that means it may not have been any of those other numbers. Or it could mean they didn't run enough tests. But let's just assume that they ran all the tests. So what causes high cortisol? Why would cortisol be that high to begin with? Well, cortisol can become high for a couple different reasons. The two big reasons is inflammation, stress, and diet. So let's start with inflammation. Anything that inflames you. So if you've got a hidden food sensitivity you didn't know about, if you have a leaky gut, you have a parasitic infection you didn't know about, you have some type of dysbiosis, all of that causes inflammation throughout your entire body. It causes cortisol levels to increase, and they can shut down the response of that receptor. The other thing that can cause elevated cortisol is if you have a psychological, emotional stress. I mean, who doesn't have that? If you have enough of that, or a big enough event of that, like a divorce, or a trauma, or something bad emotionally happens to you, or just have a crappy job long enough, then that causes you to secrete a lot of cortisol, and that cortisol can flood the body, suppress the activity of the receptor, and you get low thyroid symptoms. The other thing it can cause is if you're just eating a crap diet. Eating lots of sugars, eating lots of stimulants, simple carbohydrates, those things lead to increased levels of cortisol, and cortisol will shut down those receptors. So there's a lot of things you got to look at. This is a hidden cause, and it's quite a ways down our list because it's really by process of elimination, and your doctor's got to be able to, first of all, look at your chart and be able to spend more than 5 minutes with you to understand that, hey, look at all this other stuff you've already tried and it didn't work. Or look at you and say, you know what, your lab tests were normal, why do you still have these low thyroid symptoms? They got to put on a thinking cap, and that's something a lot of doctors don't want to do. They frankly would prefer you just, in fact, what they would like to do is for you to just show up, pay, and leave, and then never have to talk to you. I've met doctors like that, and I'm beginning to think there's more and more of them. I think they all still want to help, they just don't want to exert a lot of effort when it comes to doing that. So it requires you finding someone that understands that, look, there's a lot of reasons why you could have those symptoms. Let's work through them. Let's get a complete history and figure out what have you tried, what have you not tried. Let's look at your labs, let's run a complete lab panel. Let's look at for these mechanisms of inflammation. So there's a lot of things you got to look for, and you've got to find a doctor who's willing to do that.